Every 65 seconds, someone in America develops Alzheimer's. This equates to nearly 5.8 million Americans, 2/3 of which are women. By the year 2050, it's projected to reach 13.8 million. It is the third leading cause of death among the elderly, right behind heart disease and cancer. As our population begins to age, we will see more and more cases diagnosed. Hi, my name is Jessica Pillsbury. I've had several family members who have developed this progressive neurodegenerative disease. I have helped personally care for them, along with watching many documentaries and reading web and magazine articles. The last 5 years, I have been a captain on the Walk to End Alzheimer's and help raise money for the cure. Alzheimer's doesn't care about your race, religion, gender, or social status. It can and will affect anyone. It doesn't matter how fast or slow the disease progresses. It doesn't make it any easier on the one affected or the caregivers. Most people live 7 to 10 years after a diagnosis, but it can last up to 20 years. Today I will walk you through the 7 stages of Alzheimer's. First, we are going to start with what to expect during the mild stages 1 through 3. Then, I will walk you through the moderate stages 4 and 5. Afterwards, we will explore the most difficult of the 3, the severe stages 6 and 7. Finally, I will tell you what research has been done. To start, let's begin with the mild stages 1 through 3. Senior moments. But when is it more than just a senior moment? When you go to the doctor to find out if this is part of normal aging or the beginnings of dementia, they will ask you many questions about your health, what prescriptions you're taking, your diet, and if you've had any type of mood or personality changes. They will run many tests, including memory, problem solving, attention, and blood and urine analysis to try to rule out any other diagnosis. They may do a CAT scan, MRI, PET scan, or cerebrospinal fluid test in order to determine if you have dementia or not. Once diagnosed, you should go for a recheck every 6 to 12 months. An early diagnosis is important because you can go ahead and get your financial and legal matters in order while you still have legal capacity. Legal capacity is the ability to know what you are reading and signing. You must give written permission to any doctors, lawyers, banks, etc. to be able to speak to your caregivers or whoever you deem appropriate to take care of the matters that you have. Some documents that you will need are an advance directive or a living will. This states what kind of care you do and do not want. A durable power of attorney for health care will help make medical decisions on your behalf. A durable power of attorney will help with any legal tasks that you may have, even when you are no longer able to make decisions on your own. If you have any questions on how to fill out these documents, then you should contact an elder law attorney. One other thing you should do is get any and all assets out of the patient's name. But beware, Medicaid has a 5-year look back. So say your grandmother gave you $50,000 within the last 5 years and now she needs care. Well, y'all would be responsible for paying that $50,000 before Medicaid will help pay for any kind of expenses. Mild cognitive impairment, or MCI, at first does not significantly impact your activities of daily living. It precedes dementia, and with it you are still able to work, drive, do social activities, and live independently. As MCI develops into Alzheimer's, neurons and connections in your brain are damaged by an abnormal protein called beta amyloid. These form plaques outside of the nerve cell, while inside the nerve cell, a second abnormal protein called tau proliferates and forms tangles. These to lead to the death of the nerve cell and cause dementia. This memory-robbing disease makes it harder to do your activities of daily living without assistance. Some symptoms that you will have during the mild stage includes misplacing stuff, losing sense of time, having difficulty concentrating, and maybe forgetting how to make a phone call. At the end of this stage, you are more anxious, confused, irritable, and depressed. Your job performance may start to decline. That is why it is so important to get an early diagnosis if possible, so you can get your important legal and financial matters in check while you still have an ample amount of independence. Next, let's move on to the moderate stages, 4 and 5. This unforgiving disease has now spread to the frontal lobe. This area of the brain controls judgment, language, and reasoning. At the beginning, you may be able to be independent within a community setting. You will have increased memory loss and confusion, and you may repeat statements or moving, such as shredding paper or banging on a table. You are in denial, so you tend to hide, which leads to withdrawal. At the end of the moderate stage, you are no longer able to be on your own in a community setting. If you do not have help with your bills and shopping and stuff like that, a predatory stranger can become an issue. You may not know your address, who the president is, or what the current year is. Your existing symptoms worsen, and you need a lot more assistance. You have trouble recognizing your family and friends, and hallucinations, vulgar language, agitation, anxiety, and increased wandering are common. Multi-step activities such as getting dressed, shopping, and meal prep are no longer able to be done on your own. If not reminded, then you may end up wearing the same clothes for days. My grandma has hallucinations of a little boy that stays at her house. A hallucination is defined as hearing, seeing, smelling, or feeling something that is not really there. She talks to him along with a few other people that she sees around her house, and sometimes she will ask us if we can have them leave for the day because she doesn't feel like having any company. I believe the little boy that she sees is my uncle, her son, who died 13 years ago of a sudden heart attack. During the moderate stage, you are more dependent on someone for your activities of daily living, and you may withdraw from social environments for fear that you may do or say something that is wrong. Next, we're going to examine the most difficult, severe stage, 6 and 7. During stage 6, it has now spread to your occipital lobe. This area controls your vision and analyzing content. Along with failing vision, you are no longer able to bathe independently or properly brush your teeth. You become completely incontinent and require use of absorbent undergarments. You can confuse your spouse with a dead parent. Fidgeting, pacing, outbursts, and violent behavior are common. Your speech begins to overtly break down, which causes you to stutter a lot more, and eventually you just don't want to talk too much because you feel like you can't get your words out properly. During stage 7, a caregiver is necessary, and you may require around-the-clock care. According to Time magazine, the last 5 years of a dementia patient's life will cost roughly $61,500 a year. During stage 7, very few words are spoken, and you may lose your ability to smile, ambulate, or sit up independently. If you don't have any armrest on your chair, then you may fall over. Eventually, you will be bed or chair ridden. Increased sleeping, moaning, and groaning are also common, and complete loss of bowels is also going to happen during stage 7. You're eventually unable to hold your head up, and you will lose range of motion in your major joints such as fingers and elbows, which causes contractures. Weight loss due to lack of eating from difficulty swallowing is typical. More than half of all Alzheimer's deaths are due to respiratory distress caused by pneumonia. Pneumonia is when food or liquid enter your lungs. The point of demise is when you are no longer able to ambulate or sit up independently. Since 2000, Tennessee Alzheimer's death rate has risen 244%. In 2017, 3,522 deaths were reported due to Alzheimer's. Tennessee also has the fourth highest Alzheimer's death rate in America. These alarming statistics were found on alzheimers.org, and on their website you can click on any state and it will show you the Alzheimer's facts for that state. Lucinda Williams said, "The thing about Alzheimer's is that it's sort of like all the little small deaths along the way before they actually physically die." This really resonated with me because as you watched your loved one slowly slip away as each stage progresses, it's like they have many small deaths before they are finally overtaken by it. During the severe stage, you have zero independence, you require 24/7 care, and your body functions begin to fail more and more. As your brain atrophies, death is certain due to frailty. Lastly, we are going to talk about research. In 1906, Alois Alzheimer's, a German physician, examined a deceased woman's brain who had memory problems, confusion, aggression, and paranoia. He noticed clumps, which are now known as beta amyloid, and neural tangles, now known as tau. These two are hallmarks of Alzheimer's. In 1980, the Alzheimer's Association was founded. In 1987, Tacrin was introduced into clinical trials. It was not FDA approved until 1993. In 1993, also, the gene APOE4 on chromosome 19 was linked to Alzheimer's. More than 200 Alzheimer's drugs have been tested since 2000, but none of them being the silver bullet. Obama made the first national plan in 2012 to help with research on Alzheimer's. Since then, funding has doubled. In 2015, Alzheimer's Accountability Act was signed into law. This makes it able to submit an annual research budget to Congress. In 2018, 5 FDA drugs were approved for the front line of Alzheimer's treatment. Funding has since went from $440 million in 2011 to $2.8 billion in 2019. Out of the 5 million people in the United States who currently have Alzheimer's, 3.2 million are women. Women in their 60s are twice as likely to develop Alzheimer's than they are breast cancer. Women who are 65 have a 1 in 5 chance of developing Alzheimer's, whereas men only have a 1 in 11 chance. Vanderbilt University did a study and it came to the conclusion that tau was spread wider in the brains of women than it was in men. Stanford also conducted a study of over 8,000 participants with the APOE4 gene. It concluded that women were twice as likely to develop Alzheimer's who had the gene rather than women did not, whereas men who had the gene were only slightly higher risk than the men that did not have the gene. They believe this is because of how the gene interacts with estrogen. Unavoidable risk factors are aging, family history, and carrying certain genes. Modifiable risk factors are exercise, managing your risk for cardiovascular disease, diabetes, obesity, smoking, and high blood pressure. Since it was discovered in 1906, There's been many trials and extensive research conducted. There is still no cure. They have found out how to slow the progression of the disease, but not stop it from arising in the first place. In brief, I have now walked you through how Alzheimer's progresses and the independence that is lost from it. The most common cause of dementia is Alzheimer's, equating for nearly 60 to 80% of all cases. An early diagnosis is important, and the average life expectancy after diagnosis is 7 years. The mild to moderate stages may last 2 to 10 years, whereas the severe stage may only last 1 to 5 years. As it progresses, nerves die and brain tissue shrinks. In the time it took me to inform you of the 7 stages of Alzheimer's, approximately 15 people now have this debilitating disease. Thank you. I made this flyer as well to pass out to the class, but seeing how we are online now, I'm going to read you some of the facts from it. Some famous people that had Alzheimer's was Ronald Reagan, Glenn Campbell, Pat Summitt, Rosa Parks, Gene Wilder, Rita Hayworth, Norman Rockwell, and Sugar Ray Robinson. The top 3 states for Alzheimer's death rate, since we are number 4, the top 3 are Vermont, Mississippi, and Alabama. The closest Alzheimer's disease research center to us here in Memphis is the Washington University in St. Louis. One other fact that I have for you are most people who have Down syndrome will develop Alzheimer's. This is believed to be because they have an extra copy of chromosome 21, which contains the gene that generates the harmful amyloid protein. Thank you.